Autism spectrum disorder, ASD, is a complex developmental disorder that affects communication, social interaction, and behavior. It is characterized by a wide range of symptoms and varying degrees of severity. Symptoms of autism can include difficulty with social interactions and communication, such as difficulty making eye contact, understanding social cues, and initiating or maintaining conversations. Individuals with autism may also have restricted and repetitive behaviors, such as repeating certain words or phrases, performing repetitive motions, or becoming preoccupied with specific interests or objects. They may also exhibit sensory processing difficulties, such as being sensitive to certain textures, sounds, or lights. Autism is a spectrum disorder, meaning that while all individuals with autism share certain characteristics, the severity and specific symptoms can vary widely from person to person. Some individuals with autism may be nonverbal or have intellectual disabilities, while others may have above-average intelligence and excel in specific areas such as math or music. ASD is usually diagnosed in childhood, usually before the age of 3 years old, but some cases may not be diagnosed until later in life. The exact causes of autism are not fully understood, but research suggests that a combination of genetic and environmental factors may play a role. There is no cure for autism, but early intervention and therapy can help individuals with autism develop their communication and social skills and improve their quality of life. Stimming, also known as self-stimulatory behavior, is a common characteristic of autism spectrum disorder, ASD. It is a repetitive behavior that is used by individuals with autism as a way to regulate their emotions, cope with stress, or process sensory information. Stimming behaviors can be physical, verbal. Here are some additional examples of mild autism stimming behavior. Repeating certain sounds or words or echolalia. Playing with toys in a repetitive or ritualistic manner. Lining up objects in a specific order. Rocking back and forth or swaying while standing or sitting. Fidgeting or tapping fingers. Playing with hair or twirling it around fingers. Repeating movements or actions, such as turning light switches on and off. Staring at moving objects, such as fans or lights. Picking at skin or clothes. Self-injurious behavior such as biting or hitting oneself. It's important to note that not all individuals with autism exhibit stimming behavior, and the presence or absence of stimming does not determine the severity of autism. Also, the behavior of stimming can change over time and may decrease or increase depending on the individual's life circumstances or interventions used to support them. Stimming behaviors can be exhibited by both males and females with autism, and there is no significant difference in the types of stimming behaviors exhibited by each gender. However, some studies suggest that females with autism may be more likely to engage in hidden or quiet stimming behaviors, such as nail biting or hair twirling, which may not be as noticeable as more overt behaviors like rocking or flapping. Additionally, some research suggests that females with autism may be more likely to engage in socially acceptable forms of stimming, such as tapping their foot or playing with their hair, which may make their autism less noticeable. This may be due to the fact that females with autism may be more socially aware and may learn to hide their stimming behaviors in order to fit in with their peers. It's important to note that not all individuals with autism will engage in stimming behaviors, and the presence or absence of stimming does not determine the severity of autism. And also, some females or males may not have any stimming behavior at all. It's important to note that early intervention is key for individuals with autism. The earlier the diagnosis and treatment, the better the outcome for the individual. And also, it's important to remember that autism is a spectrum disorder and every individual with autism is unique, so the treatment plan should be tailored to the specific needs and strengths of the individual. If you suspect that you or someone you know has autism spectrum disorder, it is important to seek an evaluation from a qualified professional. A thorough assessment should include a developmental history, an examination of current behaviors and skills, and a review of any medical or family history that may be relevant. Thanks for watching.